Hello, everyone. Welcome to the Heart of Innovation. Today we have our Save My Piggies episode. So excited to have actually one of my co-hosts, Dr. John Phillips' patients. Eric and his wife Sabra are with us. And so they're going to talk about, if you recall, a couple of episodes ago, we talked about a breakthrough technology for treating those hard to treat, very small, very fragile arteries below the knee for patients who have blocked arteries due to a disease called peripheral artery disease. And the technology was a retrievable stent. Whoa, a stent that could be removed. Oh my goodness. Yes, Reflow Medical is one of the sponsors of our show, and they did not ask us to do this. This is not part of the sponsorship. This is part of our Save My Piggies series where we feature patients who have peripheral artery disease that have incredible stories. Their journeys are inspiring, and their piggies were saved. And Dr. John Phillips, you coined the phrase "save my piggies."
Yeah, I did. I mean, we started this little endeavor several years ago, and really the genesis of it was the frustration that I had seeing patients who were a little bit like taken aback and kind of apoplectic about the care that they've received, particularly as it pertained to their vascular disease and what we call chronic limb threatening ischemia. So, ulcers or wounds that just aren't healing, and they have a high rate of amputation and mortality. You're just hearing these stories about how, well, my only option was an amputation, and I just, didn't know where to go. And it always, and I'm gonna get on a soapbox here, but it always drove me crazy. And when I would talk about this at some conferences, I would always have a picture of, and I think I've told you this, Kim, that I would list like 15 famous women, all of whom had a singular thing in common, and that was breast cancer. And people in the audience knew what it was. All these people had breast cancer. Well, there's never really been a face, as far as I can tell, for PAD or CLI, and not a famous one at that. And the whole notion of recognition of this disease and understanding how lethal it is was kind of foreign to a lot of patients. And so we kind of started this movement, and really it's about the patient. It's their, we say it's, their life, their limb, their story. And I just want to use this as a mechanism, a platform to raise awareness for the disease that takes too many legs and too many lives, and particularly in the African American community, which disproportionately has a very high amputation rate when compared to, their non-African American counterparts. So this is a special episode for me as well, because it's not often that I get a patient on, nor that I have one on that's we just met like 2 weeks ago and used a brand new device that we think is going to really help take care of these folks. And Eric and Sabra are just generous enough to kind of share their story with us, and it's off the cuff and it's super informal, and we're going to have a good time. And we've already connected on some other things with respect to the African American community. So I'm really looking forward to it.
It's interesting. Just the other day, I got a call on the Global PAD Association's Leg Saver Hotline, and it was a friend of, or, long distance relative of a patient that was in a South Carolina hospital on deck for amputation. And I kindly emailed the administrator the facts about how African Americans are more likely to have these amputations. And so I'm just gravely, the way I phrased it, gravely concerned that this might be yet another one to add to this horrible statistic. And can't you do anything to save a limb? Well, I didn't hear back from the hospital administrator, but I did hear back from the family member the next day who said, whatever you said worked. We are not going to have the amputation. They're offering her additional methods. To me, that's really alarming. Why is it that they didn't offer this wonderful woman of color these options prior? We don't know. We
Yeah.
didn't have the chance to ask him. But you know what? The good news is they found the leg saver hotline and we were able to save this woman's leg.
Yeah, I mean it's all about standard of care, in my opinion. And I'm not going to say that like amputation is just easier, but it's definitive. And I think a lot of folks feel, particularly, some in our profession, that, you know what, they're going to get an amputation anyway. So what's the point? Why are you kicking the can down the road? But I mean, we don't save every limb. And part of the Save My Piggies movement is to raise awareness to patients and get them to recognize the fact that, so like when, and we've talked about this too, but when you feel a lump somewhere or a woman feels a lump in her breast, that's an alarm. Like there are red flags that fly up the flagpole, right? But people do not recognize, a discolored toe, or that spot that just doesn't go away on the pinky toe or whatever, and that's kind of what we're here to acknowledge. And the other thing too is, and this is just a fact, like African American skin tone is darker, Captain Obvious here, but it's hard to differentiate ischemic changes sometimes, or lack of blood flow changes, and I think those get missed. So we did a show on this as well. But again, raising awareness not only for patients, but the providers out there in the world who are taking care of people with vascular disease. Because it's not just those of us that are interventionalists or surgeons. It's your primary care doctor. It's your endocrinologist if you have diabetes. It's your podiatrist. I mean, the podiatrist really is kind of the gatekeeper. And I think it's working, but it's a movement that is slow. But I think we're gaining momentum, and clearly doing this and hearing from Eric, his story, and Sabra, how you've been involved too. Like it's going to be it's exciting. It's exciting.
And we had our podiatric advisor, Dr. Stacia Jones, who emailed me actually just a couple of days ago with a video, because she and I have had this conversation before, that it is a lot tougher because for podiatrists and even vascular specialists or even primary care to, especially on a person of color, to be able to see those ischemic changes. But she sent me one definitive one, which I think is important to share, and it is your skin becomes shiny, lack of hair growth, and suddenly your leg becomes really, really shiny, even without cream. And she said that is a definitive first sign that you might have circulation issues. So, definitely something to be aware of. And coming up right here on the Heart of Innovation, we're going to get to Eric and Sabra's story. You don't want to miss it. John and I are going to stop talking and give them the platform. That's next, right here on the Heart of Innovation on KDOW. Don't go away. Okay,
All right.
John, it's all yours.
All right. Very good. Do I need to do a countdown?
You do. Just give me breath after the two.
All right. Three, two, one. Welcome back to a special Save My Piggies, at least in my mind. I am we're pleased to have Eric and Sabra joining us. So, Eric, like we said, this is very informal. Tell me about your process, your journey from initially kind of knowing something wasn't right with the foot, to you and I meeting like a little over 2.5 weeks ago, and then you being the first person in Ohio to have this kind of new device that we think will hopefully help preserve toes, save the piggies, and preserve legs in patients.
Sure. Hi. Yeah, my journey started, I guess it started after I had my kidney transplant. I was more concentrated on the kidney than my feet, and was taking care of my feet myself, and which I shouldn't have been doing, but it just slipped my mind. And one day I could tell the base of the great toe was twice the size and starting to turn colors. And I didn't even think about it coming from where I was messing with the foot. And my wife told me to go to the emergency, which I didn't want to, but I'm glad I did. And once I got there, they said it was defection, had gotten to the toe, and I might lose the toe. So
And did they have any sort of reason why it was infected, or just simply that, you know what, you had a wound there, you didn't take care of it right, and so now it's infected? I mean, there was no talk about circulation or even saying, hey, you're a chronic kidney disease patient and you might be at risk for PAD. Aha, maybe there's a circulation issue.
Nothing like that. Nothing at all. You just kept telling me that the infection had reached the bone and they would try to save it, but nothing about the veins or blood flow
So
or anything.
there's a couple of comments. Number one, Eric, you know that those of us that are guys that are married to women, we live longer, right? And the only reason we live longer is because we have wives that are smarter than we are that
Right.
tell us, hey, you
Right.
need to seek medical attention.
Right.
So thank you, Saber, for helping him. But the other, like, it, I want you to kind of, if you can, let us peek in through the door of the concept in your mind, Eric. Like, you might lose your toe. That sentence, I would imagine, probably was one that you never thought you would hear in your life. And it's weird because I hear it every day pretty much, or at least there's some patient that we're dealing with that could lose an appendage. And it's such a foreign thing for me to think about because, it doesn't register. But I imagine it must be pretty like shock and awe when someone says, you're, the toe's infected, it's to the bone. Typically, when it gets to the bone, it's hard to heal. You might lose the toe. No big deal. But it's a big deal, right? I mean, like that's changing your life.
It's huge deal. Yes. Yeah, when she told me, I was in, disbelief. I just knew something was going to change. But I hate to say they were determined, but you know, they had to amputate. So
And Sabra, what was going through your mind? That's scary, not just for the patient, but your husband literally was losing a limb.
It was devastating because he had just got the all clear in January from the kidney and was doing amazing. So he's free and clear, and January 20th this hit.
yeah,
And so I'm like, are you kidding? And then when I talked to the doctor about the toe, she's like, I have to take the toe because if I don't, and that infection could go up the bloodstream, correct me if I'm wrong, but I'm sure she said the bloodstream, and then he could risk losing the kidney. So I don't know if that makes our situation different, but that was what we were told, why it had to go.
Yeah, I mean
And it
that's
was
a
really infected. It was bad, bad.
yeah, because we will see patients that we meet we'll meet them in the emergency room and the
Right.
infection has gotten to the point where it's the leg, not just the toe, but it's creeping up, towards the knee.
Yes.
And unfortunately, the patient's sick and they do get a systemic infection. And really, you have to, now it's life threatening.
Mhm.
And so, hindsight's 2020. And obviously, Eric, I would imagine, be like, man, I wish I could have changed something. But again, it is what it is, and we got to move forward. But I think that's a salient point to share with the audience. Like, hey, if there's something not right with the toe or anything, like just get it checked out. You're not like, we're not heroes here when we don't go to the doctor as guys. We're knuckleheads sometimes.
I always tell him that I'm like, listen, whatever happens, if something's not right, it's not normal. Like I can have an infection, right? But you can't. You have to go the day we see it. It's that.
Well,
So.
plus you're on immunosuppression, right, for the
right.
kidney
Yes,
transplant. So
yes.
your threshold has been lowered to get an infection. So that's even equally important. But is that how you met your podiatrist in the
Yes,
emergency room?
yes. I
Okay.
had one previous that I go see, but I went to Riverside and she was there. Yes.
And coming up right here on the Heart of Innovation, we're going to continue with Eric's story. So stay with us. That's next. We're going to hear more on the Heart of Innovation on KDOW. KDOW. Don't go away.
All right.
Um, I'm curious in terms of just so they amputate the toe, and what do they say? Wag my finger, and Eric, just make sure you don't let it get infected again. And Sabra's probably going, Eric, you need to take better care of your feet. And meantime, it's like out of your control, right?
Yes.
And we should get into the presenting the symptoms, because he did have the leg cramps, but there is that whole idea, Dr. John, where you can't focus on two things at once. That's why we always see and we always hear that someone's always saying, oh, my right leg is really bad. My right leg is really bad. My left leg's fine. As soon as they fix the right leg, and then suddenly they can't walk on the left leg.
Yep.
Maybe get into, I'll let you guys kind of dive into that if you would.
Sure. And I forget, what question did you want to ask me about? Oh, the
Well,
claudication thing. Okay.
it's just because we're going to get attacked with these vascular surgeons. I never hear it from anyone else, but the ones that believe that the only sign of PAD is leg cramps, and you have to have rest pain in order to treat. And what I have found with chronic kidney disease patients and diabetics is they don't experience claudication for whatever reason. They end up with their first real symptom seems to be, where they notice it, is the wound that won't heal. And I see this all the time, and I don't understand the pathology. I don't understand why, but from your perspective, wondering if you can get into that a little bit, if there is an answer.
Sure. But I think the next step, Eric, we should talk about, you had the amputation and then that workup, because I think that's how you ended up seeing me, right? Or seeing our team. Okay. All right. 3, 2, 1. Welcome back to a Save My Piggies episode that is close to my heart. Eric, let's continue the conversation. So now you've lost the great toe, and that's a big hit, right? But hopefully the infection hasn't spread. You're doing okay. Did they notice issues with the incision healing, or how did they ultimately decide, like, hey, maybe your plumbing isn't the greatest and we need to kind of look into this?
Well, after the amputation, I developed a wound on the side of my foot from the shoe that the hospital provides. And, it started out slow, and then it progressed. And she decided to have the ultrasound on the leg because it was getting deeper and deeper. She could see the bone. And so I thought it was one vein, but it ended up, 3 veins.
Yep.
And that's how I discovered it, from the ultrasound.
And I think it's interesting because when I talk to the podiatrists, and we kind of have this back and forth, and I don't know that there's a right answer, but we talk about, well, okay, the toe needs to go off. There may be some blockages. Are the blockages bad enough to inhibit wound healing or healing of the incision? And I often ask them, well, if you have to take it off, take it off, and then tell me how it bleeds. If it's not bleeding well, then yes, we'll go in and more urgently work on it. But so the incision line healed, right? I mean, like the incision healed.
Yeah,
So then, that speaks to, like, well, the blood flow is probably okay. And like in retrospect, they didn't know that you had these blockages, but then now all of a sudden another ulcer shows up on the 5th digit, right?
Well, I still have like a pinhole in the top of where the foot was that she
So
checked.
just
It's
not,
like it's
yeah.
a centimeter deep. And
Okay. Okay.
that was part of her concern for the first
And then
ultrasound.
refresh our memory. When was the toe taken?
What was that?
January.
Oh,
January.
January. Okay. So I mean, like, now we're, what is it, June? So
Yeah.
now we're into June, like, and that's too long for anything to heal, right? I think so.
And then
Clearly
he got
there
a
was
second infection.
On the side, yes.
He got a
right.
second.
Okay. So then you were in the clinic. I think you saw one of our nurse practitioners originally. And
I
then
think
we
so,
and
yes.
and then
Mhm.
then we met on a couple Mondays ago,
Yeah.
and I think the thing that really inspired me about you, Eric, and wanting to talk to you was, well, first of all, Saber was so well put together. I thought she's got it. She must be running the ship here. So I
She
definitely want to
is.
talk to her about this. But you most patients will be there's a little trepidation when a doctor that you just met says, "Hey, you're going to be the first one in Ohio to use this device. It's FDA approved, but yada yada yada." And you were kind of like, okay. Like,
Yeah.
I think it was cool that you and I don't want to put words in your mouth, but trusted the process and trusted us to
I
take to
did.
take care of you. Because the other thing too, during that case, we were learning a little bit as to how to use the device. I mean, I've used it before in the clinical trial, but this is real world stuff. And normally, so the artery is a singular tube, and then at the knee, it branches into three. And the kind of unique thing about this device is you can use it multiple times and in multiple vessels. And so you had blockages in all three arteries, and we fixed all three of them at one time. And we did not leave any metal behind in the artery. And because we try not to do that, because that can cause narrowing, and it can sometimes limit a procedure that you might need in the future. And I think it's also really important to be aware of. It's not like going to the dentist, but sometimes we have to kind of retreat these blockages if something comes back. Hopefully nothing will come back, but we haven't cornered the market on how to treat the blockages below the knee yet. But we're learning, and this is a device that I think helps folks. And I mean, I always wonder like what patients are thinking when they hear the doctor asking, somebody from industry multiple questions about, hey, should we do this, or what are we thinking? But you handled it with grace, or at least didn't say anything to me.
I felt
And
comfortable. I was comfortable.
yeah, and I think we had a really good outcome. And um, did you, I guess, moving backwards a little bit, did you ever have any symptoms of what we call claudication, or kind of some cramping or aching for you? Because your arteries were pretty much normal until the knee and below, and so that often manifests kind of in some numbness in the foot for patients and just not feeling right. But obviously focused with the kidney transplant, that you probably maybe weren't even thinking about it, right?
Yeah, but I do have cramps in below the knee.
Hmm.
Uh, on my right foot is my ankle's fused, so it's hard to get a cramp out of that calf because it's not working. But I do get them, and I was getting them pretty bad in this left one. But I didn't relate it to circulation at all. I just thought it was the kidney and fluids and things.
But I imagine prior to your kidney transplant, you had a heart workup, I would think, stress test, or at least something.
Yeah, I've had those quite a few
Okay.
times.
And
Yes.
so they probably felt, well, he doesn't have any blockages in the heart. Why would he have blockages elsewhere? And that's not
Yeah.
unheard of.
But with the
Uh,
foot being fused, I never did the treadmill. I
yeah.
always yeah, so I always came back positive.
So I think it's important. I have to ask you, since I haven't asked you, how's the foot doing since the procedure?
They said it's going better. The bone is she doesn't see the bone anymore, so I guess that's
We're,
positive.
we're getting
I
some
do
healing.
have a I do have a wound vac on it right now, so
Okay.
we'll see Tuesday if it's improved even more. Yeah.
Good. Yeah, yeah, this is real time, Kim. We're getting some real. Usually we interview patients after, the piggies have been saved. So we're
Yeah.
getting real time data here. That's good.
Right.
I love that. And it just goes to show that there was something going on. And if we're just going to use textbook symptoms and say, okay, we're going to use claudication, that's going to be the number one indicator as to whether or not we decide we're going to intervene or do surgery on these patients. I think that we need to rethink the symptoms. And there are a lot of doctors out there who say we do need to look at individuals and their different presentations of disease when it comes to PAD, because there are a lot of unique presentations of disease, and everyone seems to have a different experience. I would say 80% to 90% probably have this similar standard intermittent claudication to lifestyle limiting claudication to CLI, critical limb ischemia, with the rest pain that wakes you up at night and the wounds that won't heal. But I think that we need to make sure, because those who are coming to us at the Global PAD Association and our Lifesaver Hotline are similar to Eric's story, where they don't literally present in that normal way. And our philosophy is, if you are in the standard process of PAD and you are in the intermittent claudication stage or even early lifestyle limiting, walking is the best medicine. And you really do need to do conservative therapy first. You don't jump right to a procedure, because these procedures, as we've been talking about, they're not durable. It's not a matter of if they're going to fail, it's a matter of when. Although we are hoping with this new device, the SPUR technology, this retrievable stent system, that we're going to slow down the revolving door. We don't know yet. The Deeper Reveal trial, right, Dr. John? It shows 6-month data. It doesn't show anything longer, even though Dr. J. Matthews, who was the PI in the study, came on our show just a couple of weeks ago and said that he did have one patient that came back in 1 year, and he's able to log that to say, at least with that patient, he's been able to not have a procedure for at least a year for the vessel that was treated, which was really good.
Right. And coming
So
up.
Oh,
Oh,
there we go.
You
Go
go.
ahead,
I am not an Emmy award winning anything. So you take us to break.
I can't wait till he earns his Emmy and then he can never say that again. That's exciting. Coming up right here on the Heart of Innovation, we'll have more of Eric's story. I know Dr. John and I have been on our soapbox, but it's all about learning. It's all about growing. It's all about PAD awareness and ensuring that patients have the right information to make the most informed decisions for their care. So more with Eric and his wife, Sabra, next, right here on the Heart of Innovation. Don't go away.
Sounds more professional when you do it.
Except
All right, so let's
W.
what I'd like to do for the last, so what we've got, so we're plus a minute. So we're going into segment 4. Is that right, Joshua?
This segment 4? Oh, we are in
9
segment.
minutes. Okay.
But we can go 8 or 9. So
Okay. So I think for this one, I'd like to explore for you guys, like this whole process. I'd like to learn like what you thought of from initially figuring out that the bone's infected to getting an amputation to that relatively healing, but then another one to having this procedure. I mean, like this is a pretty long drawn out journey. Oh, and by the way, I have a kidney transplant. Like, how do you, I want to know how you stay positive, because your demeanor is fantastic. And what, the Eric of 6 months ago when the great toe was okay or not even infected would say, what you'd say to that Eric now in hindsight, knowing that you went through all this. So a lot to unpack there, but I'll hopefully come up with a succinct question in like 10 seconds. So, but I actually want to comment on what Kim had said as well. So I'll bring us back. 3, 2, 1. All right, let's jump back into Save My Piggies episode. I don't know which one, but this is a good one because we're having a blast, and Eric and Saber are really helping us out and being candid. But real quick, I did want to comment on what you said during the last segment. There's a differentiator between no critical limb ischemia or blood flow that's so bad that there's an ulcer that's not healing or patients are feeling it at rest, to blockages that can cause some discomfort when you walk. And yes, we can treat them conservatively when you're walking, and I try to avoid any procedure if possible. I really basically tell the patient, like, you need to tell me that this is so bad, your walking is so limited that you can't live like this, and then we will intervene. Because once you cross the proverbial Rubicon, you can't, you're gonna probably have another procedure. However, when patients have wounds, and I see this all the time as well, that we'll get testing that looks okay. And what I tell my team is that I want you to look for pulses and feel pulses down near the ankle and on the top of the foot. If you can feel them, then their blood flow is okay. If you can't feel either of them, something's wrong. and we need to do something because a lot of patients that we see have normal blood flow up until the knee, and then the branch vessels, we call the tibial arteries below, which is the ones that we worked on, Eric, have blockages. And that's what is missed often. And so that's all I'll say about that. Now, Eric, so I want you to rewind your life to before you had that issue with your great toe. Knowing what you know now, what would you say to yourself? And in doing so, say that to those that are listening to be on heightened awareness for something like this, particularly when there are risk factors. And in your case, it was the kidney disease.
Well, I would say, one thing, we can't be in doubt of our ailments like diabetes and different things like that. We tend to know we have it, but say, we really, I can still clip my nails and, take care of my feet myself, which I don't agree with. You need to get it looked at. And that was my mistake, uh, before, before it started, I had no idea, and yeah, I look back at it now and wish I hadn't touched it, and but I did, so hey, it is what it is. But I did go through a stage of depression, and if it wasn't for my wife, talking to me, and it was rough. It's rough every day sometimes, but I'm a man of faith, and I know I can, overcome anything. So I stay positive. I'm more positive now than I was before, but it's a day at a time, with all the ailments I have, and you know, looking at my leg and stuff every day, and
Do you have a new routine since this all happened? We had a surgeon that came on uh, about a couple months ago, Dr. Jacqueline Majors out of Tennessee, and her suggestion for diabetic patients especially was to have a mirror in front of the toilet, and every time you sit down to do your due diligence, then you should put your feet up and check the bottom of your feet.
Okay, that makes sense. I
I
do,
thought that was a pretty good idea.
yeah,
That's not bad.
yeah, I do check my feet every day, rub my hand across it and kind of look at it. So I
Sabro,
tend to take pictures of the bottom of my foot.
Sabro,
Yes.
what was it like for you, kind of seeing him go through the depression and you having to be the rock and like, kind of smack him across the face a couple times, like, we'll get through this.
Yeah.
Yeah, let's talk about that stubbornness.
Yeah.
How did you help overcome it?
It's I'm not gonna lie, it's been tough. You know, he has been through a lot. And but every time, every procedure, I'm like, we'll get through this. Keep your head up. My mantra in life is we gotta live. We cannot stop. We got things to do. It's just encouragement. You have to live your life. We got to make memories. We have a young son, and I
How
don't
old
want
is he?
him to see us, you know, I want him to see us no matter what adversity you have in life, you got to keep living somehow, some way. And so that's what we do.
How old's your son?
14.
14. I've got a 15-year-old. It's trying times. I don't know if I mentioned this on the air, but there's a quote from a rabbi that basically he says, have no fear. The entire world is a narrow bridge.
Mhm.
So have no fear because you're one step away from falling off all the time.
Yeah.
So unhinge yourself, have faith,
Mhm.
believe that there's a purpose for you, and keep living. And that's what you guys do. And that's why, like I said, when I met you two, right before the procedure, as I'm telling you, you're going to get something that no one in the state has. I said these guys they're inspirational. So again, I've said it enough, but I appreciate y'all being with us.
Thank you.
How do you talk to your 14-year-old about what you're going through in the hopes that he might create a lifestyle that might change his prognosis for the future, because a lot of this can be genetic.
Oh, definitely. Well, I started by trying to change all three of our diets in the house. It's easier if we all eat the same, but I've kind of taken him, say, under my wing when it comes to working out and watching what he eats, and he's doing great with it. And I just hope he's keeping it, everything I say, he's keeping it. So, yes.
I love how you turn this into a family affair and flight to make sure that all of you are able to live a long, happy life together.
Um, that's huge, right? Because this disease process starts when they did autopsies on GIs and soldiers that were killed in Vietnam. They would see plaque, or we call it streaking of the arteries. So plaque develop in their 20s. So this process starts early, and it really takes initiatives to change how we eat and exercise and take care of our bodies, because it's very concerning when we have people who do not, recognize that this process starts, and it's worse than some cancers as well. And so you doing what you're doing with your son. What's your son's name?
Eric.
Eric Jr.
Yes.
All right. Well, you doing what
Little
you're doing with
Eric,
Eric
Eric
Jr. Yeah,
Jr.
little Eric. You're gonna change the family tree.
I think that might be the most beautiful thing that has come of this, is to see him take his situation and change our son's life. Eric's a chef, and so he's an amazing chef, actually. And now my son speaks to him as though he is his nutritionist,
Sure.
right? He's like, and our son has lost 40 pounds so far. I mean, he looks amazing. He's doing very, very well. I'm lagging behind, but I'll get there.
You'll
I'll
get there.
Well, right here on the Heart of Innovation, we're going to hear some of Chef Eric's healthy food hacks, some of his favorites that could become yours very soon. So stay with us right here on the Heart of Innovation on KDW. Don't go away.
Did I know you were a chef? No, this has sparked my interest. We only have 5 minutes left, but we're going to
But
talk about.
he's an amazing chef. Like the way he cooks, everything he cooks for us has no salt, no sodium. And it's
Joshua,
delicious.
Joshua, we have our new
Eric, you just got pegged.
Friday.
I keep telling
We have our
him,
new Food Friday.
you need to do video on cooking healthy, tell your story.
Well, now you can.
Well, now
Maybe
you
this
can.
will
You can
inspire
to
him.
we have an audience of 12,000 people across our network. So you want to go live on our channel? Go live on our channel. Let's do it. Foodie Friday.
Nice. All right.
You're
That's
in.
awesome. All
You're
right.
hired. And you
Okay.
just tell me what ingredients I need to get, and you can teach me how to cook it right. Because my dad has heart disease and he has to eat gluten-free, dairy-free. We can't have zucchini because I'm allergic to it. So we're a real pair. But we're gonna get some good, like I just made healthy clam chowder the other day using walnut milk. I made my own walnut milk and added
Nice.
arrowroot and some garlic, and it
Mhm.
was great. It was beautiful. It was creamy. So we would love to hear some of your favorite health food hacks. So go ahead, Dr. John.
All right, let's do it. So we have 4 minutes left. 3, 2, 1. Well, we're rounding third on another Save My Piggies, and unbeknownst to me, I just found out Eric's a fantastic chef. So, Eric, now that you've been pegged to probably do something for Kim on the channel, tell me what's let me ask you this: what was your favorite food to make before you kind of dealt with your health issues, and can you still make that, but you turned it into a healthier substitute?
Well, I guess my favorite, I guess is barbecue. What do you say? Yeah, and yeah, they're doing it. I'm actually developing seasonings now to lower the sodium and different things like different rubs and things like that for fish and beef and chicken. So there's definitely you can just in moderation, I guess, say with the
Are you
beef and all
adding
that stuff.
into your rubs like the artery healthy garlic and cumin and
Um,
turmeric
Most
and
definitely,
all of the above?
yes,
Cayenne
yes,
pepper
definitely,
is another one. That's
yes,
number one on the list.
definitely, yes. Yeah, so and I've been really reading ingredients lately. So I guess that's a natural light, uh, learning the bad stuff and when you look at the packages and all the ingredients that are on these packages, I kind of steer away from that for my family and myself. So more whole foods and different things like that.
It's hard though to cook healthy because it's not cheap, right? I
Oh
mean,
no, it's
and
definitely not cheap.
that's kind of the in the trade-off. Eric, I want to ask because we only have a couple minutes left.
Sure.
Two things, right? You said you're a man of faith, and so what do you
Yes.
tell to? I'm assuming you go to church. What do you tell to, folks in your church community about your what you went through to try to raise awareness, or do you guys do you talk about it at all? And my second question is, I'd love to get in there and talk to your community because I think it's important. So offline, we're gonna connect. But that first question, do you talk about this or no?
Well, not really. Pretty private. Uh, my wife here, she likes to talk about it.
Does
He's
she talk
been
about it?
private, but
Okay.
he needs to tell the story
Yeah, I'm
because
going to tell it. I'm going to
yeah.
tell it too, because I know someone out there needs to hear it. And but I haven't so far.
Well, I'll tell you
But
what, if you have my word, if you want to tell the story to anybody, I'll come meet you and we'll tell it together.
all right, sounds great. All right.
Yeah, because it's just we have so many patients that we've helped through the Global PAD Association and through this show, The Heart of Innovation. And what's amazing is that moment where we get a call from someone who says, "Hey, you helped this person. They stopped me in the supermarket, or they stopped me on the street, noticed I wasn't walking right, or noticed discoloration in one leg versus another, and they told me to call your hotline. And lo and behold, they were on deck, right there for amputation. And because of that one split moment, one person becoming that angel, right? That liaison for God or whomever you choose, the universe or whatever it might be. Um, that person is saved. And so just one at a time, just going and reaching out to people yourself could make the difference in life and limb.
Yeah, and again, Eric and Saber, thank you so much for sharing your story. We love to save my piggies when hope all the piggies are saved, and hopefully the fifth guy stays with us, and you'll keep us posted. Thank you.
Thank you.
Thank you.
Thank you.